Area, including a few years here at Cocoa Kids. So we're near and dear to my hearts right here, and really glad to be part of this. And I also want to acknowledge our team, Judy Sherman, who is our learning communities mentor and guru, and Lola Cornish, Bryn Pascal, and Madison York, who is our team from Strategies 2.0, and they're managing the online and the logistics of everything. One thing I will let you know, a bit of a logistics, is when you speak, we'll make sure you get the mic and I can run it around. I'm not amplified. This mic is not for us in the room. This is for our online folks. So it'll feel weird to talk into a mic and not hear sound, but we'll do that. Was there anything else you want to say a little more about yourself?
Of course.
Okay.
Thank you.
You got your mic.
And I'm so thankful to have a co-facilitator here with me today, since this is my first time. So thank you, Michael, for supporting me and as a first timer. But I just really wanted to tell a little bit about myself and give a little background, because I'm very interested in building relationships with all of you here in the room and those of you online who I will soon meet. And thank you, and shout out to our remote site as well. I have a long background of working in prevention, and I have a personal and a professional connection to the issue. I grew up in foster care and emancipated out at 18, became a social worker, and then really wanted to start my professional career and being able to help build the community to really have that prevention to prevent children from entering into our system of care if you know there's alternatives, because we do know that safety is always the number one. So I'm really excited to be here and let you know all of that and just know where I'm coming from, because I think it's always important to know background and intention. And so my intention is really here to help create and build better communities and stronger communities for our families. And so with that, I was a part of the San Mateo County facilitating that CAPC for the last 3 years, and then moved on to more consulting work and really building a lot more policy and advocacy work with our young people who also are survivors of the system in different systems. So just wanted to give a little background and introduce myself so you all can get to know me a little as I start to get to know you.
Great.
Thank you.
We're ready to introduce our folks then?
We are.
All right then. So the other thing that's been exciting to be a part of is the county prevention planning. I won't take away too much of your talk, but in January there was a prevention summit. 22 counties were there, 30 some odd applied. Contra Costa wasn't at the summit, but signed on quickly thereafter. And for Strategies 2.0, that's been a great new way to be involved in partnering with counties and seeing the inner work of what you do the way we haven't before, and also to partner with OCAP. We would be in touch around things like the learning communities and outreach, but really in this last year we've really been teaming, and that's been exciting. And two folks I really enjoyed teaming with are Hillary Conrad, the director of the county PND Prevention Network Development Department, and Karen Joel, who is the Bay Area consultant. And that's been very exciting to be part of. So with that, I'll pass it on to you.
Good morning. I'm Hillary Conrad with the Office of Child Abuse Prevention, which is within the Department of Social Services. And I was asked to kind of do an introduction about county-wide prevention planning and where the Office of Child Abuse Prevention came up with the idea. So how did it get started? So there's a couple of different ways or reasons behind the county-wide prevention planning. One was Robert Jenkins came and spoke to the county welfare directors, and he talked about the importance of prevention in regards to law enforcement and whose responsibility it was. And he talked about that it really isn't on one person's shoulders, it's really a community idea, that the community is responsible for prevention. And when the county welfare directors heard this information, they went, okay, we didn't really see prevention as our responsibility before, but now we understand how we are part of that. So we are included in that group of people that are responsible for child abuse prevention. Then some of the county welfare directors, I think there were about 10 different counties, joined together to speak about prevention. and focus on how are we going to spread this across the state? How are we going to be the champions for this idea that your community is responsible for child abuse prevention, and that includes child welfare? So then the prevention cabinet was formed, and the group started to meet, and when they met, they came up with this idea of let's host a summit. So let's have a convening where we bring together people within the community to discuss how to approach prevention. So that was one side. On the other side, our Deputy Director, Greg Rose, has always had a vision about how child welfare and community-based organizations should be interacting and speaking to each other and collaborating and integrating their services. So he saw the community-based and the CAPCs, Child Abuse Prevention Councils, as one world, and then child welfare and the other public agencies in another world. And he wanted to merge them. So he wants them to start talking. So that was another reason behind this idea of let's bring together these county-wide teams to focus on prevention. So then we hosted the summit, and as Michael mentioned, we had 33 counties go through an application process because we couldn't host all 58. We didn't have the room for it. And it quickly came that we had 22 counties that were participating in the summit. And at the summit, we had Dr. Jenkins, who had started this idea of prevention planning and that the community is responsible, including child welfare, to come to this event, and he presented. And then we had some of the counties that are already focused on prevention also share some stories about what they're doing in their counties. So now we have these teams that have formed in 22 counties. Contra Costa has joined with us, and we're constantly promoting this idea. So hopefully one day the goal will be that we'll have 58 counties that are participating in this county-wide prevention planning and bringing the different service sectors together and collaborating and leading towards more integration in their partnerships. So what do we see success? We see success as, number one, that the group has come together and really shares what they're doing, each of them. So what do they bring to this idea of primary or secondary prevention? And just a reminder, primary prevention is where you're providing services to your general audience, and secondary prevention is where you're providing services to those families that are at risk. So possibly mental health, poverty, substance use, different things like that. So we bring them together, and now each of you is bringing what you think is important into the community. And how do you come to this shared agenda, a shared purpose, a shared mission, and shared goals? And possibly move one of your social determinants of health within your community. Make that change. It's a community-wide impact. So success that'll happen. You'll have that community change. You'll also have that you know what someone else in your community is doing. You know what behavioral health is doing. You know what public health is doing. And maybe there's some services that you guys need to be working together, or you need to say this service isn't even working and we need to approach it differently. So really starting those conversations and then coming up with a plan of how are we going to move forward as a group. So I just want to encourage you guys to continue meeting those that are, and then those who aren't, feel free to reach out to the Office of Child Abuse Prevention, and we are here for support. We recently attended a Child Abuse Prevention Council conference and had about 7 counties that said that they were interested. So we're excited to start providing those supports and get those conversations going. And with that, I will.
Thank you. Yes. All right. So I wanted to take some time and go over our agenda today, and really just thank you for that lovely introduction. And so we're here today, and the actual title of our learning community is Let's Talk About Prevention Plans. So with that, I will move us along. There we are. Today's learning community. That is my name, once again, Janae Eustace, and there's an email address to reach out and contact me. So here are some of our some of our participants today, which we have Contra Costa Child Abuse Prevention Council, we have the Greater Bay Area Child Abuse Prevention Council Coalition, we have the 4C Council in Santa Clara County, that's our remote site, Colette, and we have online participants as well. So hello to all of them. And we want to say thank you to OCAP. Okay. Move this agenda. Oh, here. So of course, our welcome and introductions. We'll move into our background and updates. That's kind of where we went. We'll get into our guest speakers, and we have a video that we'll be showing. We'll take a break. And so all of you online, please make sure you take your break too. We have another guest speaker who's coming in, and then we'll have group discussions, and then we'll come back together and have some reflections and take a survey, which will be a great opportunity for us to really know in building community like we want to, in building up our learning communities. We want to make sure that we're addressing issues that you all want to be addressed. So what's important to you in building more of this community here in the Bay Area? We want to make sure we are honoring your time, and we are very mindful of that. So that's what we will do. So set that here for a second. Okay. And now we will hear from Michael. Oh, here it is. I have it. I just turned it off. And we will hear about the prevention planning process.
Thanks.
You might. Mm-hmm.
Sorry, without it.
Those are our objectives.
I'm going backwards. Am I going backwards? No, okay. No, okay, so then I think I don't have slides on, so I will just talk about
The task and theory of change.
the
Mhm.
task and theory of change. Yep, sorry.
Okay.
So kind of picking up the story where Hillary left off, Strategies 2.0 and OCAP began working with the counties who are at the summit. OCAP's working with the counties who have, like Contra Costa, who have stepped up since the summit. Judy Sherman is working with Stanislaus County also that stepped up after the summit. And when we got to the summit, as I said, this was like a whole new way of being involved with counties. We didn't know where they were at. There was a plan for them to talk about a shared vision and one-year goals, and they did that. Then they got back to their communities and met with the other partners because only 10 people could go. And the question came back, okay, now what is this about again? And what is the shared vision and what are we trying to achieve? So we built out a planning process that that we were seeing everybody was going through. And it started with the theory of change model. And the theory of change model, in the absence of a slide, I will write it up on the board. And I'll grab a pen.
In my blue bag, I'll get one for you. Okay.
So the theory of change model, the question came from when we got back to the counties about where are we going? And really that is about, it's your vision, it's your definition of success. So long-term, it's your long-term vision. A year out, it might be your one-year goal, but it's your definition of success. Our starting point is where we are now. And to get to the vision from where we are now, it's kind of like planning a wedding or something. You have your date, you have your vision of what it needs to be, and then you start working backwards. So the vision is the work. Sometimes some of the counties anchored themselves just in the CAPC vision, or there was already some work on a vision. Some were working on a vision kind of process. Where we are now is doing environmental scans or asset mapping and seeing what's going on in the county and getting clear on what's happening. What are the existing plans? What are their goals and objectives? Because the idea of this planning process isn't that it would be something completely new or completely stamped on top of everything else. It should build on what's existing. What we find is a plan for primary child abuse prevention isn't existing in many places. County Child Welfare really has to focus on their SIP and on their accountability to the state and the well-being of children in care. So when you have a county like Contra Costa where child welfare is really saying we want to go upstream with you and really make a difference in the number of kids who are coming into the system, it's a great opportunity. And so that's an exciting thing. So you do an analysis of existing plans or existing services or what's happening maybe in the grassroots in the community. So to get to the vision, it's what will it take to get there? What needs to change? I know with my penmanship, these are just placeholders, so you just have to, what needs to change in the community? And so with some counties, we would look at the data relating to needs around the county and say, what are the risk factors that are leading to child abuse and neglect? What needs to change? And setting some targets. And when we deal with this risk factor, if we deal proactively with drug abuse for parents, then there'll be less child abuse and neglect. Then you've created a theory of change. If this happens, then the larger goal happens. And then, so to get there is what would we need to do? So this is the vision, this is the theory of change, and then this is your strategies. So what will we need to do? So their theory of change is what needs to change so that the vision will be realized? What will we need to do so that we can make those things happen? So the logical connecting thing is so that. When we write arrows on our flow chart, we say that arrow represents the phrase so that, and you mentally test it. Is that valid? If this changes, is what we come up with necessary and sufficient to make this change? Are our strategies necessary and sufficient to bring about those changes? So the logic test really is, does that so that statement hold up? And the reason we spent some time with it is because theory of change, logic model, those of us in nonprofits, we've done lots of it, right? And usually it's for a proposal and we try to plug in the things that seem to make sense. If you want to do it in a real way, it's really about that conversation is what do we think is the true cause and effect relationship that's really going to move the needle on the thing we want to change. And then to get to our strategies is what we need to do differently. And so that becomes your goals and your plan. These are the largest strategies to reach it. What's going to get us on the path to those strategies? And then, again, what we need to do, will it get us to those strategies? The first arrow, in some ways, is your initial action plan. It's the only one that's not so that. So that's kind of the framework we've brought to our conversations. Every county has done a different amount of work in these areas. So we've had, like I said, we have a data walk activity we've done with some counties. We've had vision exercises. It really depends on where the county's at on what you do at each level. But asking these questions, if these have been addressed, tells you what you need to spend more time on. Does that make sense? So out of that, and something we can share, so we can share a print up of this afterwards. We can email it out. The other thing we can share that we worked on with OCAP is a framework of the stages of planning. And those go from convening, which is getting together, saying we're going to work on this together. And I'm going to actually have it, this stages. Yeah. Right, so convening, meaning we're getting together. We're saying we want to work on improving the situation together. Then there's building a shared understanding. Really, what are we here for? What will success look like? Not so much the vision, but the success, what kind of plan do we want to create? And then as you, the next stage is establishing cohesion and integration, which is really saying what are our operating agreements, what's our MOU, what is our purpose and vision that's going to move us forward. Then you get into the planning phase, which is really working on these strategies and what we need to do to get to where we need to go. And then you're implementing and managing and assessing and monitoring. And this has been a real helpful tool, and we'll share this out because it has a lot of the kind of the deliverables and the items that we would create at each stage. And so the stages are all about where we're at in creating this. So I wanted to offer that because I think we're going to see that when we get the presentation from Marin County, and I think we're also going to see that in the video that we're going to watch, which is a great example of Lane County, Oregon, really starting with the vision and really saying what will it take to get there. Not what existing programs can we just write into this, but really what's missing, what do we need to engage the community with to get from here to there.
Thank you.
I think that's what we're after.
Yes. So I will get the video started. And I just want to let you know what we'll do next. So we will watch the video together, and then we'll split up in 2 groups. And we will probably just split the room in half, might be a little easy. We'll all get together and we will discuss, we'll have some discussion questions. And as we go through those discussion questions, then we will report out. Sound good? Do we have any comments?
Some instructions for the remote sites and the online, but it's in the room and afterwards.
Yes. Yeah. Sure that they all know at the end of the video what they will be doing, and we'll get into small groups. I'm not sure how many folks are at the remote site right now. So if it's a smaller group, you can have one shared group. If you are just an online participant, then you can make sure just to answer the questions, and I will just type in your questions to Bryn if you're online, and she will be able to follow up with you so hear your input. And if you're at the remote site, then I will call on the remote site host to hear some highlights and go over that as well. Sound like a plan?
In addition, just to let the remote sites and online audience know, I don't have the microphone. Or Michael will bring it to me. Hi to our online audience. Just to let you know, I sent you a link to the video we are going to be watching in the chat because there might be some audio or visual lag streaming the video over. So if you want to, we'll let you know when we're playing the video, and you can mute us and watch the video on your own. That way you can see it clearly and hear it clearly. So just letting you know that that's what we'll be doing, but I've sent you the link.
Okay, was there? All right, I will get the video set up. Let's bear with us.
A bunch. Yeah. Have everybody introduce themselves.
Okay.
So on the projector, we might have to pull it over to an extended screen. Sorry about the delay, everyone. Thank you for.
Sometimes I notice on the Internet Explorer, if you can accidentally click.
Michael,
Yeah.
you could talk a little bit about, what they're doing.
Okay. Okay, while they're trying to figure it out,
On
sure.
their way.
And actually,
With the mic.
with the mic, yep. Actually, Lola, you might even be a better person. Do you want to go on and talk about what you're learning from Lane County? Lola is actually going to be going up to Lane County next week. They're having a conference based on the 90 by 30 process. So Lola will describe it. So she's been studying it pretty deeply, and a lot of our partners have been keying on it. So.
Hi. So this concept of 90 by 30, the University in Eugene, Oregon is the primary lead on this. But what they've done is really bring together diverse community members to think about what is their vision for child abuse prevention. And what they came up with is to reduce it 90% by the year 2030. And their approach is really broad-based. It's very community-based. They have targeted programs that they're funding to do specific work, but there's also I'm trying to remember the name of the website. It has the word "no" in it, and it's a link. No more, KNOW more, yes, which is amazing because it lays out for you. For anyone that lives in the community, what their role in child abuse prevention is. There's a link for community members, a link for schools, a link for parents, a link for neighbors. No matter what your role is in the community, they have a role for you to play in child abuse prevention, which is really interesting to me from a broad-based model, and something that I know that the counties I've been consulting with, I've been encouraging to look at. So it's really an innovative approach and a very targeted approach. They have several programs, including the Welcome Baby Box, which is kind of a brief home visit that has materials to support the parent when the baby first comes home from the hospital, and a variety of other programs as well. What else can I say?
So one thing we could possibly do, and maybe like maybe take a break in a little bit and try to work with this during the break. But we could also get onto the No More website and have you walk us through it. The other thing I'll add about it in terms of Lane County, and I think it really carries over to a place like Contra Costa, where there are regions of the county itself that are kind of their own and very different from the rest. So they take a regional approach. For Lane County, it's Eugene, Oregon in the center, which is fairly urban, but it goes all the way from the coast to the Cascades. And so there's farm communities, mountain communities, and they've gone into each, I think it's probably, supervisor district, and worked with folks finding out what's happening in the community and have the community set targets and program priorities. So I think what we'll do is we'll get onto the no, unless, oh wait, that sounds like a sound.
Sounds like a sound, so let's see. No.
No, okay,
But we can do
Um,
the introductions too.
okay.
Mhm.
Actually, yeah, we will, thank you everyone for your patience. We'll back up and do something we didn't do in the beginning.
Mhm. Thank you. So in the beginning, jumping right in, we did not introduce ourselves. So if we could take some time just to say where we're from, and then after that, we'll probably take a break so we can make sure we get our audio issue fixed. So if that's okay, can I start with you?
Good morning, everyone. I'm Lynn Mackey. I'm the Contra Costa County Superintendent of Schools.
Good morning, Hillary Conrad with the Office of Child Abuse Prevention with the Department of Social Services.
Hi, Jenny Perlman with Safe and Sound in San Francisco, and we're the Child Abuse Prevention Council for San Francisco.
Hi, I'm Maria Garcia Puig. I'm with the Regional Center of the East Bay.
I'm Kathy Marsh, Contra Costa County Children and Family Services.
Tina Reyes, Contra Costa County Probation Department.
Michelle Mankiewicz, Contra Costa County Head Start.
Lee Pearson Brown, Contra Costa County Public Health Clinic Services.
Carol Carrillo, Director of Child Abuse Prevention Council for Contra Costa County.
Hi, I'm Liz Crudo, I'm manager at San Francisco Human Services Agency, Family and Children's Services.
Hi, I'm Kieran Joel. I'm with the Office of Child Abuse Prevention as well.
Hi, my name is Jennifer Brueggemann. I work for Contra Costa County Behavioral Health with the Mental Health Services Act team.
I'm Judy Sherman. I'm a contractor with Strategies 2.0, and I coordinate the learning communities across the state.
And online, we have Colette Kadumu at Four Cs of Santa Clara and Najib Camille from Santa Cruz County.
All right, thank you for introductions. We'll go ahead and probably take a 10-minute break, and then we'll get back together. Online, we'll take a 10-minute break, and we'll get back together. Thank you. Can we just take off of the... Yeah, and maybe we can take it off of the projector and just sound from the computer with the speakers, since everyone else has, true. And also the folks online, they're watching it from their own computer anyway, so we don't have to actually stream it. Okay, they locked that door again. Should have, okay. Okay. Really interested to see. It's a good video. That's why when I watched it, I was really happy with it. Yeah.
Is it okay? Because we have
It's not. So I've tried it with this plug. It was here, and that was perfect. Maybe if we put it the projector. Oh, yeah.
We don't have if they get the TV out and there's a USB.
Right.
we can do it online.
Okay.
So can you give me the login for my?
Yeah, I will. I can give you my. Right. Yeah, I thought it was great. I love the format that you guys had. I thought it was very well.
Okay. So probably our computer, we're not getting sound connected. We're thinking about using this computer. If you have a USB that connects to the TV monitor, we'll put the TV monitor instead. This has USB, that has HDMI.
This computer is
probably a problem.
And then I love the breakout idea. I felt I was leaving just my breakout. That would be exactly on this. I'm giving free rein to explore. That's great. That was great
Sonoma. Yeah. Because HDMI has a so it's a possibility that it's transferred.
Okay.
I'm wondering if because we're just coming off that. Oh, I'm sure. And I think that.
Oh, the video's actually over. We need a break.
Yeah, so maybe this should have been.
Right.
So it just landed right.
So I went to
The thing is we also have a television.
drive late and there's a lot of questions.
That's usually what I run.
To me, it's very obvious what it is.
Is there
But I guess for other.
a USB cable?
So maybe this video.
Oh, it just uses HDMI.
Well, we still think that computer's a problem. And so, and this one only has USB.
The thing is, you can't connect your computer to USB because the USB is only to unveil allows you to put something. So.
Yeah, I'm like, my computer. Of course, right? Lisa gives some more time to connect in the room.
I think most of the time when we've had desktop system. Yeah, I think I try not to do so on
I wasn't sure if things
Well, I don't know if.
You wouldn't have a laptop around here.
But yeah, that'll be good.
That might be,
Maybe we'll do.
I have mine too, but I just don't know if the HDMI will fit. Yeah.
and I'll need to get set up.
Did you have an HDMI port? Yeah, okay.
Mm-hmm.
So we're gonna shut that computer down.
It was lowercase. Oh, I think it might have connected again.
Oh, yeah, I can get you connected.
Okay. And I already have the 30.
And then I'm going to continue using this computer.
You want my, okay. And do you need my charger?
That would probably be.
Okay, yeah, still.
So I think your computer is getting confused because it's attached to HDMI, which should have audio built in.
Okay. Let me see. I don't have an HDMI.
And so it's automatically shutting off the output because it's thinking it's supposed to be running through its HDMI. But because you're using the VGA that doesn't have the audio, now there's no audio. So if you attach the HDMI to HDMI, it should work.
Okay.
Because the system should recognize it.
Okay.
Yep. I'll leave it online, but it's super long.
Okay, well, we can wind it up. Wouldn't be able to community without it?
Yes. Sure.
Yeah, lesson learned, do sound checks. Thank you for your patience, Janae. That's not what we had in It sounded like it would do the job.
space. Okay. So some of what we heard in the video is obviously we picked up on some themes, right? And by just like a nod of heads, did some of you hear some themes that kind of felt a little familiar, maybe not? But the first question is, how are you currently addressing some of those themes that you heard? So maybe identify 2 themes in your small group, and then talk about how you are addressing that in partnership right now in your organization, or how you are partnering to address some of the things that you heard, the 2 that you identify in your small group. Does that make sense? So first identify maybe 2 themes that you heard from the video, and then talk about together how you are addressing how you're addressing those themes. Okay, and I'll give 5 minutes since you're doing a double. Yes, so I will ask if you can nominate one person in your group to give highlight. Is that okay? And folks online, can we come back together? So can I have spokesperson, thank you. Uh, Spokesperson kind of give us some highlights and start here since you're standing up, Carol. Yes, let me get the microphone right here. All right. Thank you.
Okay, so our group, we've kind of focused on 3 different things. One was the river analogy. That really struck home for us, really thinking about being able to think about primary and secondary prevention instead of sort of downriver, which I think a lot of us have been doing over the years, sort of after the fact, intervening after child abuse occurs. So we think that's really great. We also talked a little about the regional approach, the way they sort of describe their area and their different regions. We see Contra Costa that way because we have maybe our approach in West County might be a little different than our approach in East County, and just the demographics and the cultural differences that we all need to be aware of when we're doing our prevention planning in Contra Costa. And then we thought it was really interesting, the public opinion, the fact that they had 10,000 community members that they were able to get feedback from and talk to about just their level of engagement and their level of interest in prevention. And those were things that, really struck our group.
Yeah.
Anything else, group? Good?
Yeah.
Okay. Yeah.
Thank you. All right. Right, and who is our spokesperson here? All right, thank you.
Wow, that is wonderful because we identified different themes. So which usually doesn't happen. So the 2 themes that we identified and talked about were one about the conversation at the end of the video, bringing in the community voices and ensuring that each community has the ability and is empowered to develop their own plan and use those strategies to prevent abuse that will work for their individual community. And then the second thing that we talked about was that it seemed really significant that there were goals that have been agreed upon by the region, and that everybody was updated on those goals and was able to follow them and knew what was happening in reaching those goals. Anything to add, anyone on the group? Great.
All right, thank you. Okay. So next, I'm happy to hear was there any comments or themes identified online? Nothing typed in? Okay. All right, we'll be coming back to you, remote site and online folks. So now it was a great conversation. It was hard to stop you all, but I know we have to move our agenda forward. And what about some barriers? So now we have identified some themes. So let's think about those themes and think about what barriers could you all see, and take maybe 2 minutes to talk about some of those barriers, and then we'll share out what could be potential barriers and even connecting it to your own process where you see barriers. Sound good? Okay. Let's get started. Online too.
No, I'm saying, I don't think we can.
And so I think that part of the issue we doing OCAP startup, you know, we have the blueprint up. Well, like my zero hadn't seen it, didn't know it. So then when the leadership thing, she's like, well, how did that group come down? Because we tried to, the Great Bay Area County tries to together, and then what it does is something like that. We had a campaign. I know myself, I didn't know the other ones, and I was like, I'll catch up with whoever child sexual abuse campaign. And so we took that on and we were goal of by 2015. So this is the beginning of that by 2015 we would be moving the needle and we would be able to reduce child sexual abuse in the Bay Area. What happened was we didn't have sustainable funding to be able to do it, and so it kind of it was county, that's why. But I see the importance of making that long-term trying to reach that and honestly, we're not going to make a huge change. But we're just silos.
All right, I want to bring everyone back together. And this time, let's start off with our online participants. Do we have any barriers? Okay, none that anyone shared. All right, I just wanted to check in. And let's start with this group over here this time, since we started over here. I'm gonna say excuse me and cut through your circle and get more chart paper. And who would like to be our spokesperson now for our barriers? Nominated. Okay, 1 second, sorry. Thank you, Lynn.
I talked about the barrier of having, what did I talk about? The barrier of having different multiple leadership organizations without a common goal at this point. So we have different groups convening with the same topic, but not communicating enough to form a common goal that we can all focus on for child abuse prevention throughout the county. And what was the barrier that you had? Oh, I'm sorry, I'm talking into the microphone. Try not to yell into the microphone. So the barrier, and then I'll be yelling at them, huh? Pardon me online. The barrier, what I talked about was having different leadership groups and convenings that are happening that aren't communicating, integrating with each other. So we have, which actually results in like burnout and an initiative burnout and not a common theme and not a, like a North Star that we're all moving towards.
All right. And our spokesperson here.
Okay. So, and you guys, my group will please correct me or chime in, but one of our barriers, I think, well, we kind of see this is important to be able to have that sort of that forecast down the road 10 years or whatever, but some of the I think barriers to that is going to be funding. A lot of our county work is siloed, similar I think to what you were saying, Lynn, and then also, well, funding, the sort of the silos, and then and then trends, because we all see, for all of us that have been around a long time, I do see that a lot. That it's sort of what's the flavor of the month or flavor of the year, fair and child well-being, and supporting families. So it seems to change, over time. It also seems to reinvent itself. That it may be called something different, but it's something we did 10 years ago, but now we're doing it again, but it's calling we're naming it differently, or we're maybe doing it a little bit differently. So, but there certainly is value. We see the value in having a 10-year goal, or having, that reach.
So now we'll move into our final question to bring us all back together, and really looking at how can you see the learning community? So what we're doing here today, how can you see the learning communities really being able to support and build off of not only identifying the themes and the barriers, really bringing those two together. How can this be workable, useful, and really build like what we want, the goal that we want? How do you see the learning community fitting into that? And I'll give you 5 minutes, and then we'll take a short break. Sound good? Online folks? All right. All right. Let's come back together now. Thank you all for your very rich discussion. And all right. Thank you all for your rich discussion. I hate to cut you off now, but we want to hear, it sounds like we do have some input from our online audience, and so we'd like to hear from them, and then we will come to each group. So have your report out person ready.
Yeah, great. I want to thank Najib for writing in and sharing that the learning community can be a forum to share ideas and issues that were encountered by other counties in moving this work forward. It can be a way to bring innovation from each other and to also troubleshoot barriers that may come up along the way.
Yes.
So, thanks. And that was Najib from Santa Cruz County.
All right. Thank you. We'll hear from this group here. So you're closer.
Oh, the value of having the, okay. So for here, we talked about having an entity that actually worked with multiple sites and agencies, so that if we work together, they can share ideas and what worked, what didn't work in other sites, and bring it to us so that we don't reinvent the wheel, and we're a bit more focused and efficient with ideas learned from other sites. So we see some value in having, an organization tasked with that. And also they can keep us on task because we can stray from things quite quickly.
Yeah, I want to actually speak to it a little bit, and probably you'll have some other things. Because Maria was talking about walking away with something tangible, something we can work with, and what's working, what's not working. I'm going to call out that Hillary and I are kind of the point people in the summit process. Our whole teams are the point people too, but it's kind of our job to make sure we're hearing what's happening in the other counties. And we were just talking about gathering some of the tools we're gaining in some of the counties and sharing them out, and this learning community can be a forum for that. I think also some of the experiences Jenny talked about, structuring conversations around what stage you're at in the process, given the packet that Kieran shared with us. And that's something else we talked about, structuring that conversation. So we can help with that conversation. We can help identify who's at the similar stage. I think an interesting thing is sometimes there's a concrete tool that people have found and have worked. I know Katie in San Francisco used a real environmental scanning tool, and Jenny, that they were able to share with folks around the state. So there might be some concrete tools, and there's just also the experience of what's evolving for you. How is it going for you working at this stage, that we can also help facilitate that conversation here.
Also, we talked about in our group that it might be helpful to talk in these learning communities about how to engage the various disciplines, so that, so for instance, we were talking about how do you bring probation to the table, because probation may not see themselves having a role here. And so to at least frame that discussion or those ideas.
Sorry, I don't want to speak to everything. And actually, we wanted to get into that part of the conversation. There are counties where probation is at the table. There's counties where mental health is at the table. And it'd be great if you could talk to your counterparts for whom it's working, right? To say, why is it working for you? What are you connecting to? So we can also play a role in getting people in like roles together.
Thank you. All right.
So I just want to say in Contra Costa, we're very lucky because we do have a probation representative. We do have our mental health representative. We have our Office of Education representative, and many more involved in our prevention planning work. But for the learning communities, and you guys are going to have to chime in, having sort of that regional support, that technical support, the regional knowledge brought to us by the learning communities. So we're learning about what other counties are doing, what other regions are doing around this work, is going to help us, I think, move our prevention planning forward. And again, learn what tools are out there, what other resources are happening around, particularly around the Bay Area, that we might be able to implement and use in our prevention planning work.
So one of the things that came up or actually several things, is having a common goal and common language, sharpening the message with having that common goal and common language, so everybody's talking about the same thing. So common goal, common language, and then using that for advocacy and how to advocate. And I think advocacy for to the state specifically, but I think advocacy could also be local advocacy. So how do you develop that message and then utilize it for advocacy? Oops, popping the knees.
Thank you. Okay, so we're going to move into our next portion of our agenda. And first we'll take a 5-minute break. I'll be strict on the 5 minutes this time to make sure we are on schedule. I thank you all for the conversation. I hope that I've documented some of that for us to go back on and make sure that we're meeting those goals as well. So thank you. And we're gonna have a 5-minute break, online audience. Okay. Perfect. Thank you. Yeah. Start off kind of like, but then I just bring it together. Thank you. Thank you. Thanks so much. I know. Okay, good to know that. Thank you. Thank you. Yes. Mhm. Of course. Thank you.
Instead of
right, I'm going to bring everyone together now. Thank you for that break. Hopefully you got something to drink, maybe some more snacks online. All right, thank you. So now we're going to hear from Katie Albright, and we're going to have this conversation. Hopefully it feels more like a conversation and discussion. So feel free to kind of ask questions, and we'll take Katie's lead on that. And we'll be here I'll be charting, and it feels more like a conversation, right? Because we really want you all to feel like, although she's here as an expert, but also here to have conversations and discussions with us, and she's totally cool with that. So without further ado, I'll introduce Katie Albright, who's representing Marin County Child Abuse Prevention Council. Thank you. You're welcome. And this is for online.
Thank you so much. It's so great to be here. And I got to work with Janae as part of the Greater Bay Area Child Abuse Prevention Council, and I get to see Carol, and there's so many strategies folks that are here. And I literally walked in and talked to Lola from strategies, and I was like, oh my God, everyone here knows everything so much. So as Janae said, like, let's have a discussion around child abuse prevention planning, and it's great to see our OCAP friends as well. So when you said an expert, I sort of furrowed my brows, because definitely not. Like, let's really have a discussion so we can all learn from each other. And I'll just share with you, and I think that something I may be able to provide are two different concepts of what's happening in Marin County and what's happening in San Francisco County. And so by that, let me just introduce myself. I'm Katie Albright. I work at Safe and Sound. We are a community-based organization in San Francisco, and we really do sort of three areas of work. We provide family resource center components to families that are living in our community in San Francisco. We run a family resource center. We provide support and training to the 25 other family resource centers in San Francisco. We provide a lot. We are the Child Abuse Prevention Council in San Francisco, and partner very closely with child welfare to ensure that all folks are trained and have that mandated reporter training. We also work closely with the county to provide the Children's Advocacy Center for kids and families in San Francisco. And we are part of the Greater Bay Area Child Abuse Prevention Council, and get to partner with Contra Costa and 8 other Bay Area counties. And in that work, came to know Janae, and in that work, came to know Marin quite closely. So Marin was looking for a partner to help support its Child Abuse Prevention Council. And so in partnership with Child Parent Institute in Sonoma, we in San Francisco decided to partner together to help support Marin. So we were seeing some continuity between the counties. So San Francisco was invited, as well as Marin, to be part of the Prevention Planning Summit. And so with that, I have a little bit of insight around how two counties are doing this work. And frankly, two counties are doing this work somewhat differently, but along the same path, and using the resources of their counties in different ways. So I'm excited to be able to share that with you. We couldn't, in San Francisco or in Marin, we couldn't do this work without strategies. San Francisco, as you'll see, has a great deal of resources in terms of a partnership with the Controller's Office, and so that is one thing I'll talk about. My colleague Jenny Perlman is here, and Liz Crudo from the county, and so we'll spend a little time talking about what the work has been in San Francisco, and we couldn't have done the San Francisco work without strategies. And equally so, when we were trying to think about how to do this work in Marin, it became very important on that first step after we all left the prevention summit to say, oh my God, I don't know, how do we do it? And we turned to Lola and Michael and the other folks, the great folks at Strategies, and said help, and they said, yes, we are there. So thank you so much in doing that work. So today what I wanted to do was talk about three areas. One, the prevention plan and process, and this morning you had a lot of information around that, so I'm just going to touch on it relatively quickly. Go into a deeper dive around asset mapping and give you an example of what we're doing in Marin and what we're doing in San Francisco, and then talk about something that we're grappling with in Marin around decision making, because I think this is something that's going to come up in all counties, and I want to just explore with you how we're thinking about it in Marin, and be able to ask how others are thinking about it. So let me talk about prevention plan and process. A lot of these, I think you heard today from Michael around this is how OCAP is thinking about its prevention plan, these various steps. I feel like in terms of actually going through them, they're somewhat iterative, where you think you have a theory of change and then you go back to figuring out your vision, and then you think you have your strategies and then you go back and really realize you don't. And so I think that we're all going to sort of see that. So even though it's sort of a list, I think more of a circle on that. And in order to find that vision, and I think you talked about this a little bit more, this I think actually gives more of the iterative approach, where if you want this desired vision and change, as Michael talked about, you actually need to go back and think about current work and conditions. And that is really asset mapping. And so that's what I'll talk about today. But once you figure out these current working conditions, you need to think about what are the conditions necessary to realize your change in vision. And depending on what you find, you may change that a little bit, which is why you go back to this, what we'll need to do to start, stop, and continue. And then what we need to do to bring around that change. Throughout all of this, and one of the things that we're finding out in Marin is it's really important to get the right people to the table. And think about what the right problem is that we're solving. And I shared this up in Sacramento when we had our learning session up there just a couple weeks ago, but I'll repeat it again, which is, and Hillary, I keep attributing this to you, but I think you might have sent this to me, or I saw it within the same day that I was talking to you, but Albert Einstein has this quote, which is, if you're trying to solve a problem and you have an hour, he would suggest that you spend 59 minutes on figuring out what the question is, problem that you're trying to solve, and then spend 1 minute trying to answer it. And I think that's what we're trying to figure out in this work. And I think for me, it goes back to also trauma-informed care, is really thinking about asking the question, not what's wrong with you, but what happened along life. So what's happening in communities, and how can we build on the assets of communities, as opposed to saying, oh my God, something's wrong with these communities. How can we think about the work in a strength-based way and answering these questions? So I encourage all of us to really figure out that question before we dive in, to think that we know the to it. And in that, who then needs to be part of determining the question, who needs to be at the table. And I think we'll find that we have a lot of unusual allies and folks that we can engage. I heard in this group we were talking about, I mean, education always seems like that's the right group to engage, but is it the Department of Education, or is it the nurses in the schools? And who are the people that are going to really lever and move the change forward in our communities? So again, as strategy have been sharing with us, we really think about 6 different stages: convening, building shared understanding, establishing cohesion, planning, implementing, assessing, and monitoring. And I think Michael also talked about some of this morning. Where we are in Marin, and I think in San Francisco, is on this building a shared understanding, really trying to understand what the assets are that we have in our community. And so with that, let me turn to asset mapping. And talk about what we did in Marin. We decided that we were going to focus our conversation around understanding what our assets were in the community based on the protective factors, the 5 individual protective factors: parent resiliency, social emotional competency, knowledge of parenting, social connections, and concrete supports. And our overall vision in Marin was to think about no child suffers from abuse or neglect in our county. And so we were trying to figure out, given the resources that we have and who's at the table, and we have a diverse table in Marin of county partners as well as our CAPC partners. We have 5 school district, we have the police, we have community organizations. Marin is both urban and rural. We have conversations about whether or not we have meetings in the north of Marin or in the south of Marin, who's coming. And so all those people are at the table, and we were thinking about how we could effectively and efficiently map this. So we took one session to map what the protective factors are. And we literally went around the room, and each person described what protective factors they were either delivering or knew about. So let me just go over one. So for parent resiliency, we decided as a county that there were some mental health services being provided. And our next step would be to actually map who's doing all those parent resiliency services. We do as a county provide, there's some strategies. We do provide some free counseling and parent warm line. We're thinking about what some of the performance measures would be if we did that, which would be to look at the number of parents that utilize our services. We also were thinking that as an outcome, parents would be less likely to, if they had mental health and supportive services, parents would be less likely to, let me say it in a strength-based way, parents would be more likely to be able to provide a protective environment for their kids, which would lead to no abuse. So again, we went through each one of these really in sort of a popcorn kind of way, asking who has these different resources and then mapping it out. And our next step would be to really dive in deep on each one of these protective factors. So let me just open it up and ask, one, if anyone has any questions, but two, when you think about your own county, what, if you were to do your asset mapping of your county, how would you think about your county with respect to protective factors? Just using protective factors as a frame. Carol, you had a question? Oh, sorry.
Well, thank you, Katie, for that great overview of what's happening in Marin. So in Contra Costa, our next prevention planning meeting, we're actually going to engage ourselves in looking at asset mapping. So we're going to start that process ourselves. And Kathy, did you want to add to that? Okay.
Oh, this is so challenging. I know, get up and move. So Contra Costa, much like San Francisco, I think we're at that same stage of just kind of like, what do we have here? You know, before we can make plans for anything else, we need to know what our starting point is, what our baseline is. So I think we've done a pretty good job of bringing the people to the table, and we're still getting to know each other at the table, and then we'll have to decide who else needs to come to the table, and then we need to start doing the mapping. So baby steps.
Other examples online? How are you thinking about asset mapping? How are you thinking about protective factors as a lens by which you look at and do your asset mapping?
So my question is, it looked like, or I think what you said was that the asset mapping was done with the partners who were in the room. So did they think at all about other assets in the community that could also apply to that? Broaden it.
Absolutely. One of the questions that we had we got to particular supports, and we have some in Marin, right? There's housing subsidies, but what we talked about was we need more affordable housing in general, and housing wasn't at the table. And then we had a conversation about, is it housing developers that need to be at the table? Is it the Board of Supervisors that need to be at the table? Is it our county housing department that needs to be at? Is it economic sustainability organization? So we did ask the question, we didn't answer it. So we're still sort of trying to understand and ask the question. And my guess is that we're going to find that with every single area as we begin to dive in more deeply. We're both going to understand what our opportunities are, what we have there, but we're also going to definitely talk about what our gaps are. And also related to that, what our work needs to be, because our work may not need to be trying to develop out our own programs. Our work may need to be calling people up on the phone and getting them to come to the table. So. I want to just turn it over to Lola quickly, who's been helping us.
Just also that with the really broad focus on asset mapping and including non-traditional partners, part of the work may be educating folks that things like housing subsidies and high quality early childhood education are in fact prevention strategies, even if those non-traditional partners don't see this that way.
I would say, looking at this and in the inputs, right? So it's, effective factors, input strategies, performance measures, outcomes, and vision. And we're really still focusing on the inputs here. And once we collect all those inputs, we'll have a better sense of what the gaps and opportunities are to think about what our strategies might be. And then from there, we'll focus on performance and outcomes measures. And Lola, remind me, you're facilitating meetings to really go through each one of that. And I'll hand it to Lola to talk about what the work plan is.
Yeah, so our next stage, it will actually be happening tomorrow. We'll be looking at a very broad vision statement that gets to the heart of what we're doing, but isn't necessarily wordsmithed. And then we'll be looking at asset mapping and alignment with existing plans that are already in place. So for example, the Health and Human Services just did their strategic plan, First Five just did their strategic plan, and looking for areas where we're in alignment around prevention type activities. So that's our next stage that we'll be going into. And then we'll be going through the other stages as well, thinking about specific strategies, looking at the gaps in the data or in the existing service delivery and where the most impact could be made. All of this work was really an exercise in showing the group how the model works. And we did this very quickly in an hour or so. But the real work is obviously a lot more intense than that and a lot deeper than that.
Thank you. We have one more question. No, it's good.
I just wondered, it's a little bit hard to read. Is it possible to make that slide a tiny bit bigger? Just slide the projector back. Sorry.
I don't know the answer to that question, if we could make that bigger, but we certainly can send it out electronically. Yeah, why don't we do that? I think it was mostly exemplary, but yeah, absolutely. Oh, that's great. Thank you. Thanks for that comment and suggestion. I'm going to move on and talk about what we did in San Francisco, which has same overall goal to do asset mapping, different approach, both in what the lens we took a little bit and how we did it and who the partners are. So I have a few slides, I'll just walk you through that, and I am going to definitely turn to my San Francisco colleagues for backup and support. So our overall goal in San Francisco was to do a comprehensive view of our prevention efforts, to identify our gaps in service, and to, in San Francisco, very explicitly prepare for families first. It was something that was really important to us because we are a 4E waiver county. And so we're all preparing for families first, but it was something that we intentionally are talking about in San Francisco. And so you can see from this, it's quite similar to Marin's goals. Right? Let's do a prevention plan. Let's figure out this comprehensively. Let's identify our opportunities and our gaps, and let's plan for the future. And so we have taken the following approach, which is it was really important to us to start with defining prevention. And I'll show you how we did that. And then to broadly go out, and this was a partnership with the Controller's Office, who in partnership with, Jenny, remind us, who was it? It was partnership with Family and Children's Services. Department of Children, Youth, and Families, First Five, Department of Public Health, and probation. So it was really the departments that are supporting financially and partnering with community-based organizations to understand how we can provide comprehensive support to children in need. And so it was really to look at where are all the county's resources going, to identify those direct services with the county, to consolidate all of this information, and there's much, and to summarize the findings. And so what I wanted to do is just really focus on that defining prevention, because what the county looked at in following the leadership of OCAP is understanding what is primary, secondary, and tertiary prevention. And I'm sure that people have this document, but if you don't, it's like the best thing since sliced bread, really defining which each one of the levels are. And so these were the definitions that we used in order to go out to our community, to go out to our government departments, to ask them what services are in each of these areas. So just for, a quick run through, primary prevention is really thinking about and focusing on general population and strengthening that area. Secondary prevention begins looking at risk factors. And tertiary prevention is when there has been maltreatment and what are the services that are going to be provided, mostly within the system, so to speak. And so after a really huge comprehensive analysis, and this is really the only finding slide that I'm sharing with you, we determined that most of our services are in the secondary level. And that there was a lot of opportunity, not just to do more primary prevention services, but actually to understand what primary prevention services that we in the county have. Because the reality is our contracting didn't go that broad. Our findings are sort of the bundle of contracts that we were looking at didn't go that broadly. We didn't look at childcare subsidies. We didn't look at housing. We didn't look at some of the things that might traditionally be considered primary prevention. And so that might be an opportunity that we look into, or we just use the data where it is and we go forward with our prevention planning. The other thing that we found really in the secondary and tertiary area was that we provide, and you don't see it on the slide, but we provide a significant amount of mental health services to kids, which is great. And yet it's not necessarily prevention to provide that mental health services to kids after something's happened. What could we as a county do to provide mental health and family support services to caregivers and parents? And so that's something that could be an opportunity, and certainly the data unfolded on that. And let me turn it over to Jenny and Liz just to highlight anything that I missed in terms of some of the big findings, some of the things that you are thinking are that we found in the data that I didn't explore, or that are sort of next steps of what we're thinking about doing. And I just sort of threw into this, so.
I think you touched on them, but one that I wanted to highlight is not only did we realize that the county was spending a lot of money on mental health services for kids, but on services for kids in general. And the light bulb moment was, we don't want to put the burden on kids to prevent child abuse. It's the adults that need to prevent child abuse. It's the grown-ups. And so what is it that we're missing in terms of service, supports for the families, like Katie pointed out? So that was a big finding. And then it was also this idea of, it's so complicated for our systems to even determine what are the primary prevention efforts going on in the county, as well as what are those things going on to support families. And we need to think about that. What's wrong that we can't think about it? It just, again, highlights the fact that we have been looking at tertiary prevention and then moved to secondary. I think it's a great new developmental phase that we're all in, which I find super exciting. I think the field is shifting, and people are starting to really look at, how do we look at those social determinants of health? How do we look at primary prevention? So I think those were the big light bulbs. Liz, do you want to add anything?
Just in terms of the process, because we have so many departments and we're a resource-rich county, there was a lot of information I think the controller's office had to absorb. They weren't as familiar with the language, getting everybody on the same page, common language varied. And so that was kind of a challenge. So in some ways it was just like this big data dump, and how do you slice and dice it, knowing that we wanted to line it up with Family First, as well as with the 5 protective factors. So I think we've got a good foundation now to really move forward with identifying the gaps, not just with the child service focus, but in general moving forward. But it was kind of an unwieldy process in some ways. Right, so because of Family First, there is a focus, is that what you mean, Jenny? On evidence-based practice. The federal clearinghouse, I think, has 12 or 14 services identified. We do have a lot of evidence-based practices in San Francisco, primarily in the mental health sector. So like child-parent psychotherapy, trauma-focused CBT, that kind of thing. But whether or not those are on the federal list there's so few on there that we have some work to do, I think, with making sure everything lines up and advocating for some of those programs that we think are really good that we want to make sure get on the federal website. And also just, I think, advocating for that website to be a little more open and give some programs that we know are strong the opportunity to be identified eventually as evidence-based. Yeah.
Thank you. So two different counties, two different stories. We're sort of still in the same place in both counties, is really trying to understand what our opportunities are and what our gaps are, still in that asset mapping place. Two different counties took different approaches. One really in Marin, thinking about putting the protective factors as the first thing. And then the second in San Francisco, we also were looking at the protective factors, but the first thing we did was try to really understand primary, secondary, and tertiary. So we're both getting to the same place, doing it slightly differently. Within that, one county really looking in a very comprehensive way about all of our contracts and going through that in San Francisco in a very methodical way. And in Marin, using our resources that we have there and having the community come together and think about what we have in terms of that. So different approach. And I think we'll all get to the same place, but we may have different timelines, different people at the table. And what I think is most important is it really depends on what the county needs. It's sort of like families, right? Meet families where they're at. So meet counties where they're at in terms of doing this work and leverage what your own assets are in your county to be able to move that forward. And I think a lot of this is just about engagement and how do we get everyone on the same page around how to move forward. So we just need to be on the path together. So just turn it over to folks just to ask questions. What, as you think about your own county, could you use the 3 levels of prevention to think about your own counties, or how are you doing that in your county around gaps and opportunities that may be existing in your own county? So not through that protective factor lens, but through the 3 levels of prevention lens. Anyone doing that work? Maybe anything on the phone remotely? Yes, Michael.
Just want to give some thought to the evidence-based practice and the families first. I think a difficulty with evidence-based practices, there's plenty for secondary and tertiary prevention. That when, if something is an intervention, then you can have kind of that experimental setup where you're comparing one group to another. Prevention is going to be tougher. And I'll pass on to Janae, and Janae can pass on. I know the Centers for Disease Control and Casey Family Programs came up with evidence-informed primary prevention strategies, things like early care and parent supports and things like that. But it's going to be tricky because a lot of energy is going to go into families first, and a lot of energy is going to go into evidence-based. And you're right, we need to advocate for what counts as evidence-based. And there's actually, I believe, is it on our website yet? It's on the California Family Resource Association Facebook there's a chance to give input right now, and we can share a link to that as well. It's on our Facebook too? Yeah. Yeah, okay.
Thank you. Let me just touch on the last subject around decision making, and this is like real time. We're actually discussing this in Marin tomorrow, so it's a little bit of a preview. We're trying to figure out how do we make decisions, right? We potentially are making decisions for other departments. We're making decisions for other community organizations. We're making decisions, most importantly, for families. And so who needs to be at the table is something that we're looking at. What does that process of decision making look like? Because we want to get to April, right? We want to have a plan by April. And so we might pull a steering committee together. We're thinking about what, I don't know if you have this practice. I think we do it at the Greater Bay Area Child Abuse Prevention Council. I think this is where it started. We have this 5-finger rule where if you agree with something fully, you vote 5 fingers. If you're like, yes, I'm in agreement, but I may, sort of be shaky. 4, 3 is I'm going to support it, but just because I want to. I'm not totally in love with it. 2 is I really don't like it. I have more questions. And 1 is I don't like this at all, right? You can have any versions. You can define the 5-finger rule in any different ways. Right. Gives everyone an opportunity to weigh in. It allows for consensus at some level. We also talked about, so that's one way we are talking about it. Another way is just have majority vote. There's some pros and cons to that. We have not gone to the way of just saying it's one person's vote, authoritative. We haven't gone there. And so I would urge you in your counties to think about decision making. I mean, we do it in our everyday work in our organizations, but as a county, how are you going to make decisions? And then who needs to make decisions? Do the board of supervisors need to get involved probably on some of this? And so how would you sort of map what that looks like? So I don't have any answers to any of these questions. I'm sort of just formulating the questions. But I wanted to just put one more question out to you. And I know this is, it's a question. It doesn't have an answer to it, but I know we're all working in our own counties. And I know some counties in the Bay Area are included within the prevention planning formally, and some counties are learning and doing it as well. And so I just put this question out there, and I don't think we're there yet, but is there a possibility when there's a time where we as a region can think about our own regional prevention plan, and what would that look like? I think there's some opportunities to use the Greater Bay Area Child Abuse Prevention Councils to help other networks that are here, but our families are moving across our jurisdictions. And if we think about housing and we think about all the protective factors that are needed, we're probably going to need regional solutions. And so I think there might be an opportunity in the future to think about what a regional solution might look like. We're about 19% of the population of the whole state. We're about the size, if you look at all 10 Bay Area counties, we're about the population of Los Angeles. So as a collective, we actually have, 1, a lot of families that are here to support, but 2, a lot of opportunities for some political momentum. And representation up in Sacramento. So I'm not proposing it, I'm just putting the question out there. I think it would be fun to think about. And with that, I'll turn it over back to Janae.
Thank you so much for all of that. So posing the questions, I mean, we heard so much, right? Hearing about evidence-based practices. I would also say look to our partners in that way, because what we know is that when it comes to home-based services, there's way more evidence-based practices on the probation side of things and juvenile justice side than any other practice. So you're right, bringing everyone together, knowing your right partners, making the right decisions. And in that same light of decision-making and conversation, if we can break back into our same small groups, we're going to go over some more questions in small group discussion to really move us into what that prevention plan, what it can really look like. And we can check in to see if we have any online questions before we move forward with that. Let me give you the.
Thank you. So we have sort of a question and comment. The first kind of goes back to your question about the 3 levels of prevention. And in Santa Cruz County, they're doing asset mapping using the 5 protective factors, and then categorizing each asset on whether they are primary, secondary, or tertiary prevention. And so they're trying to combine both frameworks and use them both as much as possible. So that's the comment. And then we also have a question from Najib from Santa Cruz. And one issue he believes that lies with the evidence-based services is that many of them do not apply to community of color and haven't considered communities of color. Also, there are various cultural practices that can impact child abuse prevention, but that don't have, the evidence-based research. And so his kind of question for, brainstorming with the audience is, how do we include these evidence-based practices? How do we include these cultural practices that don't have evidence-based research in our prevention efforts?
Curious if anyone has a comment or thought about that.
I can talk a little bit about what we've done with parent education in San Francisco, where we have a lot of different evidence-based practices, including Triple P, but we also have some homegrown programs and a couple of the FRCs where we use the same outcome tools to measure the effectiveness and got similar results. So we continue to fund those programs, which are bilingual, work is going to be, I think, is moving into this family first world and the funding, because those are not going to be, you know, the funding is going to have to look different. So.
Thank you. Any other thoughts or comments? Mine is that I think it's really incumbent. I appreciate the question a lot, and I think it's really incumbent upon us as we're doing these prevention plans to actually call for this, that evidence-based programs have to be culturally competent and responsive to our communities. Now, do we have them? I think there's a gap in time, but I think it's really important for us to call that question out and put it as a mandate of what we want to do. So that's just an idea.
Just to build on that question, I'm wondering if anybody in here or online has resources for that, because I'm concerned. I'm a pediatric practitioner. That I've seen more families lately from the Mideast, and some of those families are very matriarchally centered. Grandmothers are making decisions based on their being raised in another completely different culture. I don't know of any programs like that, and I kind of struggle in my practice to be sensitive, but in terms of child abuse prevention, I think that's probably an area that's not explored, at least evidence-based wise. And I just wonder if we know of any other cases, any other resources that are working with that.
Well, I know only of one study, and I'll get before we leave, I'll make sure to get the link so that we can share it out. And the studies by Mary Dozier, I believe it's the only evidence-based practice that is with families of color. And it's because it's based out of Philadelphia, out of the University of Delaware. So not Philadelphia, the University of Delaware, Mary Dozier, and it's looking at it's ABC for short. So I'll make sure to get it to all of you before we leave. But it is the only evidence-based practice that is home-based, family-based. It is a prevention practice with prevention into going into the child welfare system there, but also in rebuilding. It's based off of developmental brain science. So, anything else with that? All right. So again, Okay. So I will bring us our attention over here and we'll get a highlight of, is there anyone who'd like to speak here? You can give us a highlight of your conversation. 1 minute. So, Judy? I'll try. Thank you.
And then I'll get help from the group. Okay. So Carol started with talking about being excited about the Families First, and kind of what it brought up for me is really, as a group in the early stages of forming, really understanding or having a common agreement and understanding about what you mean by prevention and who's the target population that you are focusing on. Because it's sort of like saying, okay, we're going to address poverty, right? It's a big bite. So you have to narrow your bite so that you can focus. And I think, you know, kind of circling around to the 90 by 30, that's one of their strategies, is really narrowing the focus in each one of their regions, so that, and each region isn't going to do the same thing, but they really talked about what's important in their region. So I think just having that initial conversation about, are we responding to this great opportunity with Families First? And if so, where does that take us? And if we're still trying to do primary prevention, how does that fit in?
And I'm just wondering about with the 90 from 30, what there's, I guess online there's a structure of what public health can do, so yeah, those, and I think that's going to be helpful to us to look at kind of what they developed in terms of each profession and what their role is around primary and secondary prevention.
Thank you. Excuse me. I'll come over here. It's we're snacking. It's getting close to lunchtime. I know.
We have our plan, we're good. Oh, okay.
Take it away.
So what was the question we were responding to? Because we got, yeah, because I think we might have answered a different response, or.
No problem. What issues and structures in your community are impacting families' well-being and contributing to the incidence of child abuse and neglect?
Okay, so where we went with our conversation with, one of the biggest impacts in Contra Costa County is that we are a community, a commuting county, meaning we have many families who are not at home. They're in the car commuting to and from work, long days, sometimes holding 2 or 3 jobs, and it definitely impacts the quality time for parents and their children and the ability to engage in services. And that's a realistic challenge that we have in our county, because families are struggling with just their basic needs of shelter. And, you know, I don't see that our county is becoming more affordable, and housing is a big issue for us here. And how do we, you know, allow more quality time between parents and their children when they're just working 3 jobs just to keep a roof over their head? And, you know, we have to address that somehow. We can come up with the best plan, but we have to be real about, you know, a family who needs to come to a school meeting has to take time off of work, which means they're not going to be paid. And then that has that impact, that stress. And we're just saying the number of stressors that our families are experiencing has gone up over the years. And it's a real concern for us. Is there anything else?
Well, we also talked about it's also both the affluent and the struggling families as a matter as feeling the stressors of time and work and not being able to engage with the family.
So true. And I will get a comment here and then I'll move us on.
This is to kind of think a little outside of the box. So earlier there was a conversation about, do we focus on the children? Do we focus on the parents? I think what you just said makes the case for focusing businesses and working to create family-friendly environments at businesses. And so that, this is a stressor for parents. How can we reduce that stress? It's not necessarily focusing on the parents, right? It's saying what's causing the stress and how can we kind of, put the pin in the balloon and work with business to say healthy families, healthy employees, and make that case, and how can they be involved? So are they one of the assets in a community, the conversation? And if they are one of the potential assets, how do you engage them? And then sort of make the case that they're part, they do have a role. So, they are one of the categories of roles that you might want to think about.
For sure. Wow, so much discussion. I promise the time. For online participants, I did send over a picture of our survey here. So this is, again, this goes down to planning. We really value all of your time, but we're also wanting to build that continuity. We want you to come back. And we want you to bring folks with you, right? So come back, bring people with you. Let's start identifying who could come. And we want to pick out our next learning community topic. And so here is a survey. What I'd like for you to do is everyone around your table, not you all online, I'll give some separate instructions, but on your tables, please, you'll see dots and you each get one dot. So if you can get one dot and prioritize out of these two topics, what would be more interesting for you to participate in for the next learning community? And for Colette, I did email you a picture of our survey questions. So if you can work with your group on that, online participants, I will make sure that you have a way of seeing this. And then just choose one. So you online don't have dots, but if you can just select your priority and type it in as a response, we'd appreciate that. In the room here, if you can just get up and select which one you would like to prioritize. Next, you also see postcards on your table. And those postcards are for me to take from you all. And if you can just highlight one thing that you're going to take today from today's conversations, one thing that you're going to take with you that will really impact and change how you work with the families and the people that you're serving. And write that down on the card for me, and then I will collect those. And if you are online, if you can please type in your response to one thing that you're taking away from this experience today that will help impact or shape your working with the people that you work with, families or people in the community, adults in the community. And then we have our survey here to take in the end. So I'll give you all some time to get that done, and then I'll make sure to collect everything. If you can just look up to me when you are completed with all the different things we have going on. So we'll have a little bit of walking, a little bit of writing, a little bit of typing, and then we will come together for a final closing. And I will convene you all again at about 11:58. Okay, thank you.
person that's still on, everyone else kind of had to run.
All right, I'd like to bring everyone back so that we can close together. Oh, very. This is great. Yes, it's the momentum we want. But I also want to respect all of your time. Okay, so the plan is for me to send you back these postcards. So make sure you fill them in, even if you use your agency address, I totally get it. But just so that I can get them back to you, and online participants and remote site, I will still get your information and still send you your postcards. And I believe we have an online response. So I'd like to give a second to share that, and we'll move forward.
Yeah, so our online response is from Colette at our remote site in Santa Clara County, who wrote in that the 3 levels of prevention provide a guiding framework, and that their second takeaway is that they'd like to narrow the focus on what areas their county would like to focus on. And then for the next learning community, their suggestion was focusing on agency collaboration and breaking down silos and the strategies to break down silos.
Nice. Also winning in the room, the same topic. So is there anyone who'd like to give just a closing taking away today that they will apply to their work moving forward? Anyone like to share? Okay.
This is Karen from the OCAP. So I think just making sure that all of the Bay Area counties know about the learning communities again, because I think it's just that constant reminder is important. And now I think with this shift in focus, I also think there are a lot of folks who are looking to do some peer sharing. And I think, this is always an opportunity to do that. So that's my commitment after this meeting.
Thank you so much. And again, I want to thank you for coming. I look forward to all of our upcoming learning communities together. I look forward to being your facilitator. Thank you to all of the strategy staff. Thank you to Carol. And thank you again to all of our online participants and our remote site hosts for all the help and support. I look forward to getting to know you all and seeing you next time. Bye.